Tobago's Secretary of Health, Wellness and Family Development, Dr. Agatha Carrington, is assuring there is a pathologist available on the island. This assurance comes as forensic pathologist Dr. Valery Alexandrov has indicated his intention to quit even before his contract comes to an end in 2019. Dr. Carrington responded to a question posed by the media on the matter, and Patricia Nicholson has the details.
A pathologist is readily available at the Scarborough General Hospital. The challenge, however, may be with a forensic pathologist who deals mainly with criminal cases. Health Secretary Dr. Agatha Carrington said the THA should be concerned about the unavailability of a forensic pathologist in Tobago.
We must be concerned as an assembly in terms of the challenges posed to our population, and I know that Honorable Chief Secretary will interface with the Minister of National Security in addressing the challenges that we have had with respect to this matter, because this matter is not new.
There were occasions when bodies were left piled up at the Scarborough General Hospital mortuary because of the unavailability of a forensic pathologist. In the majority of those cases, the task of performing the autopsies fell to Dr. Alexandrov, who at one time said he had to discard his personal plans to travel to Tobago to do the autopsies.
There are 3 forensic pathologists hired for Trinidad and Tobago by the Ministry of National Security, and those 3, Tobago being part of the whole, the expectation is that services will be provided to us. There appears to be a challenge in terms of the coverage between and among themselves, but my understanding is the 3 are hired for this country.
Dr. Carrington said she was not in a position to say how work is shared among the 3 forensic pathologists because that was not under her purview but was under the Ministry of National Security. She said she could only speak for the pathologist who does work for the TRHA.
We have jurisdiction over the pathologist that works for the TRHA and comes in and does the postmortems that are not those that are criminal in nature. They're 2 different arrangements. And in that case, that person comes 3 days a week, do the postmortems we have, and also do the slides we have. So that's one arrangement covered by us.
On Wednesday, Dr. Alexandrov said he was tired of what was happening with autopsies, especially in Tobago. He said he had to make a recent trip to Tobago to perform autopsies because the other 2 forensic pathologists, Dr. Hugh Vaughan Devines and Dr. Eslyn MacDonald Boris, were unavailable. I'm Patricia Nicholson for C News.
A better system whereby data is collected and stored in one place will be introduced under the Division of Health, Wellness and Family Development. The division was given approval by the THA Executive Council in April for the establishment of a medical registry on the island. This was the announcement today from Secretary of the Division, Dr. Agatha Carrington.
Data such that we can plan our services much more appropriately. This is in line with the National Strategic Plan for Chronic Non-Communicable Diseases.
Dr. Carrington said she feels certain that with the organization of the data, they will have a better idea of the trends of the population, which will allow for the division to arrange its services accordingly.
Registering, we are going to be data with respect to diabetes, cardiac disease, hypertension, cancers and disease, hypertension, cancers and the like. Data is available on the island, but not yet stored in any one location. Not yet stored in any one policy research planning.
A timeline was not given for when this new service will be up and running.